ask you, where are you from again?
Minnesota,
Minnesota.
United States.
Okay, Minnesota. Well, I'm sitting in Spain. And what time is it at your end right now?
It is almost 3 o'clock
3 a.m. or
p.m.
3 p.m. 3 p.m.
Yeah.
Okay. Now, what are your symptoms that you're going through right now? What's bothering you? Is it a pain? Is it some sort of a discomfort?
My stomach's really bad,
Right now?
like leaky gut and stuff. Even right now, yeah, that's partly what kept me up all night. I
Okay.
have severe back all the way from my head all the way down to like bottom of my tailbone, my hips, pelvis, the whole area, like around like a belt almost like. It
Okay.
gets so tight, like I have to have it massaged out super hard. Like I do stretches and it's so minimal
Okay.
effort, like my whole entire upper half basically, and then my digestive.
And digestive system. Mm,
Yeah.
do you know where the problem is in digestive system? Is it the
Uh,
stomach or is it the liver? Is it intestines?
I
Pancreas?
believe it's intestines and leaky gut. I've had stomach issues all my life pretty much,
Okay. Sorry to hear that. But
but it's, obviously gotten worse over time. And, I take Pepto-Bismol and I get constipated. If I don't take it, then I get the other way kind of thing. It's just seems like it's always something.
right. Okay. Okay. So tonight we are gonna do healing, and trying to take care of your pains in the stomach and in the back, right on your spine. Okay.
Okay.
Yeah. The spine and the back is also painful right now.
Yeah. The lower back, the very lower back and my hips and pelvis.
Hips and
Like
pelvis.
it goes all the way around, like it goes all the way around my hips like this. And then my
Hips
very lower
and
back.
Okay. Okay. So would you like me to work there first?
Yeah, I think so.
Okay. And how about the pain comes up in the back as well towards your neck here? Because
Yeah, I have a lot of nerve damage and stuff from a car accident.
oh, okay. How long ago was that?
8 years maybe.
Okay, and you've been in pain since?
Pretty much, yeah. And then it just
And
seems like it's getting progressively worse every year.
would you say it's a chronic pain?
Yes.
And do you take like painkillers for it? Or
Not really because I get ulcers and so I can't take anything for it.
oh no, of course, because of the stomach. Yeah.
I could
Okay.
take a little Tylenol here and there, but yeah.
And a massage, I guess, helps, right?
Yeah.
Relax.
But I mean, I don't go get massages because I can't really afford it, but my husband helps once in a while.
Okay. Okay. Um, So, okay. So now we're going to start with your hips and around the pelvis area at the bottom of your back and up the spine. So I will do this one first. So now tell me uh, on a scale of 0 to 10, okay, 0 being no pain and 10 being the worst pain you have ever experienced in that area. Where is the pain now? Just give me a
10.
really wow.
Yeah, it's bad.
Okay.
Like I have a hard time even sitting. Like I'm always either laying flat or standing up because it hurts so bad.
All right, Jill. Okay. Okay. So you comfortable?
Eh,
Okay.
Yeah.
Perfect. Okay. Close your eyes and I start now. Yeah. Sorry. Oh yeah. How are you
What
feeling?
was that?
Yeah.
Huh?
So, how are you feeling with it in your back? Any
A
changes?
little, a little teeny bit. I'm still hurting the hips and pelvis area, but I feel a little more relaxed.
Okay. And what would you say? What would you say on the scale of 0 to 10? Was
Probably maybe
10
8.
8? Okay, so it has come down a little bit. Where do you feel improvement more at the top in your neck and the shoulder blades and the spine, or at the bottom? Where is more
Um,
improvement?
Actually, I do feel a little bit looser in the top up in here now that I think about it.
Yeah, I worked there. Okay. And at the bottom, there is no improvement at all on your hips?
Not on the hips, no.
Not at all. It's 10 still, right?
Yeah.
Okay. Okay. We continue. Close your eyes,
Okay.
relax. Mm. Yeah. Hello.
Yep.
Can you move around and see how it feels now? Great. Okay.
Uh, I do feel some improvement.
Okay. Okay. Move around and see. Test it well. So let's.
Yeah, I definitely see some improvement. I wouldn't say like a ton, but like I do feel some better.
Okay. Where?
Now
Where?
my
Sorry.
the hip and lower back.
Okay. It's tough, huh? Okay.
So
But
now the biggest thing now that's really uncomfortable is the
yeah, I can
my
imagine. I feel the inflammation. Lot of inflammation there, a lot.
yeah.
I feel it.
Yeah,
Would you say it is now? It was 10, so
probably a 7.
7. Okay, so we brought it down 3 notches. And at the top here, is it still 8 or is it better?
Mhm. I'd say about a 6.
About a 6, so it's even better. Okay, good. Okay, so we are making progress. We continue.
Okay. Yeah, just the biggest thing that's hurt now is the intestines and the stomach all around the
Okay, feel them well. Is it still hurting the same way, or do you feel there is a little improvement there as well, or not?
in the stomach part. No, probably not any difference yet.
By the way, just to ask you, is there anything wrong with your kidneys as well? Any
Not
chance?
that I know of. I've
Oh,
had everything tested last year and nothing came up.
okay, fine, fine, no problem. Just asking.
Okay.
Okay, relax again. Let's see. So up in the 6 and down is a 7, right?
Yeah.
Okay,
Intestines, I would say about a 8 or a 9.
okay. Jill,
Yep.
how's your intestines now?
So I laid down and you started doing your thing and my stomach instantly started gurgling and doing a bunch of stuff.
Yeah,
So I definitely feel something good there.
okay. How's the pain?
Let's see. I want to say it went down at least a couple notches.
Okay, so it's 8 now, you think? Do you want
Let's see
to
what
move it, sit up a bit and just check?
uh, right now I want to say probably 7, 6, 7.
Right.
Quite a bit of difference. Like it really was moving around and making a bunch of noise.
Did you feel any, and did you have any
It took
sensations
to
like,
lay down for it to kind of do something, you know what I mean?
yes, I was, I know. But did you
Yeah.
feel like a feeling of cold sensation or warm perhaps? Or
I
not?
would say, yeah.
Sorry?
I would say warm sensation, yeah.
Really? Okay.
Yeah.
Because some
And then
people,
everything just gurgled big time.
yeah, okay. So I'm just gonna keep doing what I was doing.
Okay.
Okay, okay.
So,
So it's like 7-6 right now. Okay, is that right?
okay.
What?
Yeah.
What is okay? Okay, I'm good. Jill, hello.
Hi.
Was it gurgling again? Or no?
Not really gurgling, but just very relaxed.
Just really relaxed. Okay.
Yeah.
Yeah, that's the idea as well. Because when I relax you so that you are way more receptive, it works
Yeah.
well. Yeah, because when person is like or tensed and agitated or when you're doing healing, it's harder and it just like goes by just bounces back. So the more relaxed you are, more you get it basically, more you
Yeah.
absorb it and more you keep it better as well. Okay, so how's your intestines right now?
All right. Let me think for a minute. Just not think of the pelvis part. Quite a bit of difference, I would say. Probably about a 5.
5 now. It was
Yeah.
7 or 6 you said, but now it's 5.
Let's
So it's just
see.
a tiny difference then from the last time. I mean, not from the very beginning, but from the last time difference from the last time.
Yeah, I do feel a difference, but
Just say it as it
hopefully maybe if I get some sleep tonight too, it'll all start feeling, you know what I mean? I'm just so exhausted too that it's hard to, you know what I mean?
okay. Well, just say as it is. Say what you feel, and
Yeah.
just attach a little number to it, and so that describes.
But I definitely the burning has gone down for sure.
Okay, well, it was 10, so from the start.
Yeah.
Then it came down to 7 to 6. You said it
Yeah.
was a kind of a nice job, and now. Did it drop off? Did it come down? Is it better than it was the last time after the healing we did
Okay, yeah, I'll say about a 5, yeah.
the
Yeah.
okay. And how's your back?
The back part's pretty good.
Yeah, what does that
The
mean?
biggest part I'm feeling now is my right hip part.
Right hip. Okay.
Yeah.
Okay, raise your right hand, please, because I kept me getting mixed up. So that's okay. My right hand is your right. Okay, like like this, and left is up. I guess. Okay. So what is in the right? Give me the number. What is it now?
Uh, about a 7.
Well, it's gone up now.
Or let's see, yeah, I want to say about the same as it was. It hasn't gotten any better since last time. I have a hard time with numbers, you know what I mean? But
How?
like I'm feeling that point spot and it's nowhere near as tight as it was.
Okay.
Like it's not super tender like it was a little while ago.
Okay, so is it little bit tender or is it still quite a bit tender?
A little bit tender.
A little bit
A little
tender.
bit tender,
So
but nowhere near like it was, but it's still kind of tight kind of thing.
okay,
But
so then
tender
it's more
cut
it's
it out
way
quite
so it's way less than 7 then.
a bit. Yeah, I'm terrible with numbers like Like 1 to 10, I'm like, I don't know. You know what I mean?
No, just so, I
But
mean, we said that 10 is the worst you've ever had, and then
yeah,
0 is basically no pain. So 1 would
yeah.
be just like a tiny, I can still feel it, it's still a little bit there, or still a
Yeah,
little,
so I would say I want to say like 50% better than when I started.
okay, okay, so basically 5. And what about the on top of your neck and that here, and
I
just
would say about 75% better on the neck.
75% better, so it's like
Yeah,
2.5, let's say. Yeah,
yeah.
it's way better. Okay. So I would ask you to sit and or lie and relax. Close your eyes again, please, for me.
Okay. Hmm.
Jill,
Yeah.
tell me how is your front feet here?
Hmm. Let's see. Ooh, I think I'm seeing some improvement.
What is that?
I'm walking around a little bit. Yeah, I definitely feel so much looser for sure. Big difference.
Okay, do
I
you
want
have
to say right now maybe we're 75% better
75%? So
than when we started earlier. Yeah.
okay, so the last time we checked was still 5 there, which was worse.
So
Or
I want to say about a 3 then maybe.
3? Okay.
I'm impressed it's actually working.
Yeah, I'm not impressed because it's not working fast enough for me. So, do you know what? How are you feeling now? Can we stop the session because I'm feeling really tired and it's difficult to concentrate? And we can, and um, I would love to follow up with you
Okay.
and perhaps catch up with you and see how you are this evening, tonight, and how are you tomorrow? Perhaps
Okay.
an email, and we can do another session perhaps in a couple of days' time or 3 days.
Yeah, maybe do it a little earlier when you're not so tired.
Yes, and when I haven't had such a very busy day.
Yeah,
It's this work is very tiring actually.
I can imagine. Yeah.
Yeah, it's really it's
I said maybe even took on some of my stomach stuff. Who knows while you're healing?
yes, exactly. It's like yeah, it just takes a lot of focus and concentration.
Yeah.
Yeah, and for someone else, looks like I'm just sitting there with my eyes shut, but I am 100% engaged, 1,000% engaged mentally. Yeah,
Yeah.
yeah, that's but it's fine. Um, so can I leave you now? So let's say what is it right now? Your intestines was what? The
So
number?
my intestines, I want to say at least 50, I would say about 50% or maybe even a little bit more. So I
Okay,
definitely don't feel like I need to pass gas or anything. So I want to say, I
are you
think the hip is what's the least amount of feeling better, but everything else I would say is pretty significant.
okay?
Yeah.
Okay, so hip is in front
But I
here,
want to say 50% still on the hips. So, I mean, I barely could sit or walk before we started. So,
but now you can.
yeah, so it's definitely much better.
Okay, great. So
And
I'll,
who knows, maybe if I get a good night's sleep, it will even, you know what I
yes,
mean?
this
Because
is
I know
very
sleeping
important.
heals you. So,
Yeah, sleeping is very important after my healings. I don't know how other people do it, but when I do the healing, I'd like to ask people to just like rest a little bit right after, like 20 minutes. Just lie down, rest, and sleep is the
Yeah.
best. At least 20 minutes. If you sleep longer, fine, even better. Okay, so
Yeah.
when you are moving, everything is moving in your body, your cells are moving, energy is moving. So, and it's trying to kind of get in and change things in your body, you see. So it's hard at work, excuse me. So you need to give it you need to give it a big chance to just like do its job. So
Right.
energy will be with you now for a few days, even
Mm.
a couple of weeks actually doing its thing. Yeah. So
Okay.
yeah. Um, uh,
Alrighty.
okay. Well, we'll catch up again in 3 days' time.
All right. Sounds good. Yeah.
Right. I will drop you my email address and um uh, you can send me an update how you
All
are.
right. I will.
All right.
Thank you so much.
My pleasure, Joe.
Good night.
I'll see you soon. Bye. Have a nice
Bye.
day. Bye.
All right.